Welcome back to Renegade Medicine. My name is Jay Allen. I'm joined again by my furry friend Nietzsche. And today I will be talking to you about everything pharmacology. We're going to be diving into some tips on how to study and then diving into resources that you can use to excel. I'm a current MS3 on rotations, and hopefully some of this advice can help you be the best that you can be during your first 2 years of medical school. So, on that note, let's go ahead and dive in talking about the basics of pharmacology. Alright guys, before we continue, I'd like to give a shout out to my best friend and inspiration for starting these YouTube videos, Mark O'Donnell. If you guys are a little bit tired of studying medicine or burned out for the day and are planning your next med school vacation break, go ahead and hop over to Orca Videos. My friend Mark has put out an incredible channel. He travels all over the world doing awesome things and talking about all these great things you can do in these locations. So if you're already thinking, oh, this neurology block is killing me, I can't wait for my vacation, go to his channel if you like travel videos, and maybe he can give you some great insight in where to go. Orca Travels, Mark O'Donnell, my inspiration for these YouTube videos, giving a shout out to the inspiration that made me do these videos. All right, let's go ahead and dive into the tips section. Basically, what is pharmacology? Pharmacology is basically the study of drugs and their effects on the human body. So for you first and second year medical students who are just diving into this topic, you're basically going to be looking at a couple things over the drugs that you use, and you're probably already a little bit familiar with some of the basics. So for instance, we all know the basic ibuprofen, which is an NSAID. And some of you might be familiar with, that blocks pain by blocking prostaglandin synthesis. So, this is something that we see every day. Hey, maybe you have an uncle that's on an ACE inhibitor or is on a statin. So these are things that, these are going to be the things that you're prescribing patients. So, how should you go about studying pharmacology? So when you're studying pharmacology, basically kind of think at the big picture. Think about how the drug works, what disease it's used for, and then how to go about using that drug. So you're going to be looking at drug classes, like what type of drug it is. You're going to think about how does the drug work. So when you're studying pharmacology, think what does this drug do? At the cellular level, how does it work? Where does it work? What other interactions with drug does it have? You're also going to be thinking about what diseases that drug is used for. And then also think about you're going to be learning about the off-label uses for drugs, or maybe some random adverse effects that it has. Basically, what you're going to want to be thinking about when you're studying pharmacology in medical school is pretend for every drug you learn, for everything that you know, is think about you're explaining the drug to a patient. You have a patient says, "Doc, what is this drug?" And you have to basically explain to the patient, hey, this is what it is, this is its class, this is how the drug works, this is what it's used for. Hey, Doc, what adverse effects is it going to have? And you're going to explain those to the patient. Hey, doctor, I'm taking these drugs, and these drugs. Now, obviously, in the hospital setting, you're going to be a little bit more familiar with those, or maybe your hospital has a pharmacologist that you can check with. But, as far as the boards go in studying, those are things that they expect you to know. So, on that note, I think that's a little basic over pharmacology. Let's dig into the next topic. So, let's talk about how to study for pharmacology. So, a lot of you younger medical students are every time you see a new pharmacology micro pathology, you think, how should I go about studying this? So for pharmacology, basically it's going to be very similar to microbiology. So as far as my school goes, we saw pharmacology concentrated in year 2. And so what we did is most of the books and materials that you're going to see are broken into the basics. basically the first part is going to be how drugs work in the body, their pharmacokinetics and their pharmacodynamics. Basically, how does the drug enter the body, how is it metabolized, where does it go, and how to figure some of those things out. Then most books and materials are going to be divided into sections based on organs. So you'll have like a cardio, pulmonary, renal. It's going to be broken up into those types of sections. So when you go about studying pharmacology for you younger medical students, is you're basically going to follow that along as you go. The trick to pharmacology is going to be repetition. So, you know, what I like to tell people, medical students, is how to go about this is use multiple sources, you know, constantly repeat. This is very similar to microbiology, is that you can't just, you see, okay, this is Staph aureus, I've seen it once. No, you got to see it multiple times, because every time you see it, something new is going to stick that's going to help you increase your board score. So how you should go about studying pharmacology is what I recommend is we're going to dive into some of those resources, but think repetition, and kind of you're going to be following along based on your organ system. And if you've been doing any reading during your first year or before medical school, that is awesome. What I like to tell students who ask me for advice is, as far as pharmacology goes, you know, it's not rocket science. I think as medical students, we have learned that we can pretty much teach ourselves. You know, some people don't even go to lectures. You know, anyone who knows me knows I am not a big fan of going to class. However, some of those things can help too. So it's kind of whatever type of learner you are. So let's go ahead. We've talked about kind of a general idea of how pharmacology is set up. Let's go ahead and dive into the tips. So my first tip for pharmacology is going to be flashcards. Flashcards. So right here I have pharmacology flashcards from Brenner's. I haven't used any others, so I can't tell you how the other ones are, but I can tell you that the Brenner flashcards are amazing. So what I mean by this is that basically what I would do is after I would get those things down is I would pick out my flashcards, and if I was over neuro or whatever, and I would just go through them. I would look at, oh, clopidogrel, how does this work? What's the mechanism of action? You go through it. If I knew it, I would put it on the back. If it was something I wasn't so familiar with, I might set it to the side, and then when I finished, I would go through the ones that I wasn't very familiar with. But flashcards in medical school, I think, are phenomenal. If you want to learn pharmacology, if you don't just want to have, if you don't want to be able, when you're in the hospital wards, when you're on rotations, doctors are going to ask you, what drug are you going to give? So it's not just being able to recognize it on a piece of paper and say, I think I know this. You really need to know drugs like the back of your hand. And so kind of what I tell students like this is, I bartended during my sciences, so I can be familiar with this, but think about a bartender. Think about the bartender mentality. When someone tells a bartender a drink, he has to know what liquors to put into it, at what amount, and kind of know what those liquors are like. So in a weird way, that's kind of what you need for pharmacology. If you're following your attending and he says, hey, this is the diagnosis, what drugs would you give and why? You have to know like the back of your hand, hey, I'm going to give this, and this. And sometimes they'll say, okay, what's your second line therapy? If that doesn't work, what are you going to go to next? So as far as pharmacology goes, get some flashcards. Go through these a couple times. What I would do is, people would see me at the gym and think I was weird for doing this, but it really helped. I would take flashcards to the gym, and when I was resting, maybe a minute and a half, 5 minutes, whatever it came down to, I would go through those. And that really helped me build up. It was a fun way to learn medicine. Or when I was drinking my coffee in the morning, I would wake up, drink my coffee, and go through a set of pharmacology cards. The more times you can go through those, the more you're going to learn. When I learned Spanish, cuando yo empecé aprendiendo español, no hablé como hablo ahora. Repetition. When I went about learning a second language, I would always forget words, but it was constantly refreshing things, constantly practicing things. How do I speak in the past tense? Hey, if I want to speak in the future, how do I do these things? Repetition. You would build a foundation one day, and then you would just keep building on it. And flashcards are going to help you build on that foundation. Because when you're studying pharmacology, just like everything in medical school, you're going to constantly be forgetting things. Day 1, it's fresh. Day 2, it's fresh. Day 3, you start to forget things. By week 2, you're like, oh man, whoa. You're like, what type of cell was in that ovarian cancer? I don't know. So flashcards are going to help you really learn and really be able to recall pharmacology concepts. So I think that's it for the flashcard tip. Let's go ahead and look at my next tip. So my next tip for my young medical students is get a question bank. So right here I have PRETEST pharmacology. I really like this question bank. It really covers a lot of the basics, and it's definitely a doable question bank. So during medical school, why are question banks important? So question banks are important for this reason. When you're studying medicine, when you're a younger medical student, a second year, a third year, even where I'm at right now on rotations at the hospital, you don't know 100% what's important or what level you need to learn the material at. Hey, if this has I can't give this drug with ketoconazole, or this drug has an interaction with warfarin. You might read that in the book and think, I don't think that's really important, and it's not going to stick in your brain. But the thing about question banks, especially for pharmacology, is these are written by experts, or these are written by doctors, specialists who know what material is important over the drugs, what interactions are important to highlight. And these are going to give you a really good idea of what you need to be looking for in your pharmacology textbook, when you're watching pharmacology videos, when you're studying drugs. One of the biggest things that you can learn in medicine, which especially as a first and second year medical student, you're still kind of learning, is you're learning on what's important to know. A small part or a large part of studying medicine is figuring out what's important to know and what information is a little less important to know. Adverse effects, probably need to know those. Mechanisms of action, like the back of your hand. Hey, you give this drug once every 14 days. Maybe a little less important, but something that, you still should probably learn. So questions are written by people to help you learn what to focus on. And especially in pharmacology, these are going to help you stick concepts that you might not have picked up your first couple times through. If you're looking at a drug and it says, hey, you give this drug and now your patient has hypocalcemia and you're also giving this drug, why did this happen? Pharmacology is all about making connections. The more you can say, I've got this piece of information, I've got this piece of information, and I can link those. Questions help you link those concepts together. So if you know, hey, this is spironolactone. Hey, this person has hypokalemia. You do a question and it says, this is why you're going to give this drug and not furosemide. Then you have that link. That's a little basic question, and you'll get, that's something that you should know, not a hard question. But when you see that question, you're not going to forget that a second time, and you're always going to remember, hyperkalemia patient, this disease, I'm going to give in a high blood pressure, or for whatever reason, I'm going to give a potassium-sparing diuretic over a loop diuretic or over a thiazide. So when you're studying pharmacology, those questions are really good. Think of them as like the highway between cities. If you know this, and this, but you can't recall those, or you haven't made the connection between the two, questions are really good at helping you make those connections, those logical connections between the two. Not just knowing fact A and fact B, but knowing why fact A is important to fact B. So when you're studying pharmacology, definitely find yourself a good question book. I would recommend Pharmacology by PRETEST, but go ahead and find whatever one works for you. What I tell medical students is, what might work for me, what might be my preference, maybe you find another series a little bit better. But that's my recommendation for pharmacology. On to our next tip. So my next tip is going to be start early. So what I mean by that is definitely don't be like me. Be a lot smarter than I was. And what I mean by that is you're in medical school. At the end of 2 years, everything is going to be covered on that exam. So what I mean by that is you can kind of make your medical school curriculum yours. And what I mean by that is definitely pass your tests, definitely do well on your tests, but you can start, especially in semester 1, semester 2, and during your breaks, studying and pre-learning material that you're going to see in the future. And why do I mean that? When you're in your first 2 years, you're going to see a bunch of diseases, and if you do what I did, you see, you read the pharmacology and you think, okay, this person has hypertension, you could give these drugs, and you kind of just take that bit of information and you throw that in the pile of, I don't know pharmacology, it's not going to be on my exam yet, I'll learn it later. I think you're really kind of not hurting yourself, but you could be using that information and learning it now and helping yourself prepare better for the future. And what I mean by that is, as a first and second semester student, if during the breaks or during your weekends or maybe a day where you're kind of a little burned out on the pathology reading, you're like, I want something new and fresh to read, pick up a pharmacology book. And what I mean by that is the basics of pharmacology are not incredibly hard to learn yourself. And what I mean by that is a lot of it is, think of it kind of like recipe cards. You kind of figure out, a little bit of how this works, and then you just got to know the drug and know why it's used and know how it's used. It's not like understanding an EKG. It's not like learning the pathophysiology of the heart, learning the connections of the heart, learning the physiology of the heart. It's a little bit more memorization based versus concept based. There are a lot of concepts in pharmacology, but it's a lot more kind of like learning recipe cards. So start early. When you see a drug, read up on it. Make a list of drugs and think, I'm going to learn those this weekend. Or maybe when you are going through your cardiology unit, watch a video over cardiology pharmacology on YouTube, or watch the Lecturio videos. The Lecturio videos are very short and they're incredibly high yield. And what I mean by that is, if you learn the basic pharmacology drugs, every time you learn some basic drugs, every time you see that drug during the first year, it's going to stand out to you and you're going to understand it a little bit better. So if you're reading a pathology book and it says this patient has this, you could give nitrous peroxide, but this drug also has the effects of becoming poisonous toxin to the human body. That's going to hit you in semester 1, and you're going to take that with you through your studies. Rather than you hit year semester 3 and semester 4 and you're learning that for the first time, you've lost yourself a year of having that information stand out to you and having your mind really hold on to those facts. So if you start watching basic pharmacology videos or do those things during your first semester, second semester, every time you see that from that point on the future, that information is going to stand out to you. And not only that, you're probably going to get some brownie points when you're in case conversations or in class. The professor might ask a question and say, okay, who knows how these calcium channels block? Or he says, hey, this person has a nodal block. Any of you guys know which antiarrhythmic you're going to use? Ooh, maybe your hand goes up and the professor says, wow, didn't know you knew that yet. So starting early, definitely a good thing, not only for pharmacology, but definitely microbiology. So that tip, start early, and we'll dive on to the next tip. So my next tip that I'm going to give you guys is the rule of 3. And what is my rule of 3? This is something that I tell every medical school student, and it basically more or less applies to every single concept in medical school. So this is my rule of 3. You need these 3 things as a basic starting point for every subject that you see in medical school. And if you use this rule of 3, you're going to have a firm foundation for every topic you're going to see. And you can use this rule of 3 and kind of tweak it to how you study and make it your own. So what do I mean by this? For every topic you see, you're going to want a major textbook, 1. Second, you're going to want a high yield review book, whether that's BRS or the high yield series or the big picture series or the Lippincott illustrated series. You're going to want a high yield source. And then my third part of the rule of 3 is you're going to want a question bank, because that's going to help you make those associations and also reinforce areas that you might not be strong in. For pharmacology, I also add to the rule of 3 flashcards. And for microbiology, sketchy. But that's another story. So the rule of 3, if you use that for pharmacology, that's going to be a strong starting point. And also, based off of that rule of 3, tweak it and make it your own. And what I tell medical students is, don't just listen to my advice. My advice was the best for me. However, my advice, 90% of it might work really well for you. Maybe your learning style isn't like mine, and how I study doesn't work for you. However, I think the rule of 3 is going to give you a very firm foundation to start on. And if you use that rule of 3 and start tweaking it as you study, or adding certain things or taking some things out to make it the best for you. Take a little bit of everything you hear on YouTube. If you type how to study pharmacology in medical school, you listen to somebody that says, oh, I got a 250 on the step. I got a 260 on the step. Okay, what worked for him might not necessarily work for you. Maybe his learning style is a little bit different. A problem that I see medical students get into a lot is they say, I'm going to study exactly like this person. And then they end up doing really bad on the next test. Or maybe they do really well. But what I mean is, how person A studies isn't necessarily what's going to work for you. Take the best from the smartest people you hear, synthesize their tips for what works well for you. Same thing for me. I tell people, start with the rule of 3 and then make it your own. Use that as your foundation, and then you can kind of add things or take some things away to help you learn the material better. Maybe you're more of an auditory learner, and you say, hey, I can't read textbooks the best, but if I watch a video and have someone explain it to me, I will never forget it. So, repetition, resources, all those things. Rule of 3, on to the next tip. Alright, so now we're going to be talking about resources. So, I've already talked to you guys a little bit about these Brenner flashcards. What I want to talk to you guys next about is this main textbook. What I used for pharmacology was the Brenner series. And why I like the Brenner series is because it's very easy to understand. This book intros into the pharmacokinetics, pharmacodynamics, rate of eliminations, antagonists, agonists, and then it dives into drugs based on organ systems. I started off using the Katzung book, but I found Katzung a little bit more dry. I think for the average medical student, or for most medical students, they're going to enjoy or make it through the Brenner's pharmacology. I just think it's a little bit better well written. It communicates the material better, and it's easier to read through. And the reason you're going to want this main textbook is start off with this. This is the first thing I go to when I want to learn pharmacology. So if we started our cardiology 2 block in semester 3, the first thing I did would read through this chapter. And it's kind of at the beginning when you're studying pharmacology, you're not 100% sure what exactly or how to think about pharmacology, but make it through that chapter. You're going to have the basics, and then you've got level 1 of the information you need, so then that you can build on that with videos, questions, your high yield, and pharmacology. So as far as resources go, I would recommend picking up Brenner's Pharmacology. Again, they're not paying me for this. I probably don't even have enough views to get any money for this, but this is a great book. It's what I used throughout semester 3, semester 4. I wish I would have started it during semester 1 and semester 2 during my breaks. But this is what I think is the best pharmacology book, or this is going to be one of the best pharmacology books and one of the best to use as your main textbook. So when you're looking to pick up a main textbook, I would recommend looking into Brenner's. You can find this on Amazon. You can find this at your school textbook. Caveat, normally for textbooks, I say that you can pick up an older edition of a textbook. However, for pharmacology, you're probably going to want the newest edition. And what I mean by that is, I think for all the topics outside of pharmacology and maybe micro, but especially pharmacology, new drugs are coming out all the time. Mechanisms are being understood better and better as every year progresses. And I think pharmacology is one of the medical sciences that is progressing at probably the fastest rate, or one of the fastest rates, or at least out of the material that you'll be studying in semester 1, in semester 2, semester 3, semester 4. So bite the bullet, I would say, and pick yourself up a new edition of the textbook and a new edition of the pharmacology cards. If you are really, really tight on money and you say, I'm going to pick up an older edition of the book, I wouldn't recommend it, but at least make sure that your flashcards are the newest edition. So that is my review for the main source, Brenner's. Pick this up and you will do all right in medical school. All right, so let's dive into my high yield sources. All right, so let's talk about high yield sources that you can use for pharmacology. So what I used as my high yield source was, I used Lippincottt's Illustrated Pharmacology series. But I didn't use it a lot. And what I mean by that is, pharmacology, I think, if you read through the main textbook, for me, I kind of highlighted that with videos. So I really didn't use my high yield source a lot. How I studied other topics in medical school, I would read through the textbook as fast as I could. Then I would read through the high yield again so the information would stick. And then before the exams, I would go through question banks to make those links and associations, or to highlight material that maybe I missed during my textbook, videos, or high yield series. So as far as that goes, you can use Lippincottt's if that works for you. It's an all right source. It's a lot more to the point. But for pharmacology, for me, I mainly stuck to my main textbook, Brenner's, flashcards, question banks, and then I highlighted that with videos. So let's go ahead and talk about video resources you can use for pharmacology. Now on to the video section of pharmacology resources, something that I think you will probably enjoy a little bit better. So students are saying, what video series should I use for pharmacology? So there are going to be 3 main ones that I think are going to benefit you guys a lot. So the first one that I think every medical school person and probably their parents and significant others that they talk to about this material is going to be SKETCHY PHARM. So as far as SKETCHY PHARM goes, I was not a big SKETCHY PHARM user. I was a big SKETCHY Micro user. What SKETCHY PHARM is, for those of you who do not know, is they kind of do these little goofy drawings, but they do the drawings, the cartoons, and talk about them over the high yield things. So if they say, hey, they might draw someone coughing, or they might draw a Pokemon coughing, and say, this is to remind you that ACE inhibitors block the degradation of bradykinin, which leads to a cough and angioedema, or something like that. But do it in ways that it sticks, and they kind of talk through the drug and everything that you need to know about it in kind of a fun and relaxing way. I wasn't a big SKETCHY PHARM user because I thought their videos were a little bit longer than what I wanted to put in per drug. But I know a lot of people that swear by SKETCHY PHARM. I swear by SKETCHY Micro, but I wasn't quite a big SKETCHY PHARM user. if you like Sketchy Pharm, or maybe you're not a Sketchy Pharm user, maybe try watching them when you eat. Something that I found for me is Sketchy Pharm is really, you're learning medicine, but it doesn't feel like you're learning medicine. So what you can do is in the morning when you're eating, watch Sketchy Pharm or Sketchy Mike. When you are eating lunch, watch Sketchy Pharm. Before you go to sleep, watch an episode of Sketchy Pharm, 10, 15, 20 minutes, and you've got another drug learned. The next video series that I really like is Lecturio. As far as Lecturio goes, some of their series are hit or miss. And what I mean by that is some of their lecturers put together a really good topic or a really good series that I think is really high yield and really good learning. But the problem with Lecturio, at least in my opinion, is you're kind of watching some of their other series and you kind of get a feeling like you're wasting time. You know, you're like, hey, I just dedicated an hour to watching these videos, but I really didn't feel like this was my best use of time. Especially in medical school, we are always thinking about time management and what is the most efficient use of my time. However, if you do have Lecturio, their pharmacology series is phenomenal. The guy talks about the drugs, it's very clear, it's very short, it's very to the point, and it helps. How I would use Lecturio is I would watch it about once, twice, sometimes 3 times during every organ unit to help those drugs stick. If I watch a 5-minute video over acetylcholine esterase inhibitors or muscle relaxants, I see those, I see the name, he talks about it, it helps it stick. The next video series that I recommend for you guys is going to be the board review series. The board review series, I think, is a phenomenal series for medical school students, especially during their second year. This series is sort of geared a little bit more towards prep and review for taking the USMLE step, but it's also a phenomenal high-yield source for learning material for pharmacology. So, if you are looking for a video series, which I highly recommend, I would recommend looking into Sketchy, BRS, or Lecturio. And what you can do is a lot of these, if you don't want to pay for them, they have a week trial. So you can try these out for a week, see if you like it, and see if it's something that you want to invest in. I would not recommend into looking for pirated copies. I know that there's a lot of them out there, especially for medical students looking for things on the free. But think about it, these guys put in a lot of work for these. I pay for my subscription for board review series. I paid for my subscription for Lecturio. Help these guys out. They did something awesome. They put in a lot of their time to give back. But I do know a lot of medical school students kind of go through other routes to find these materials. But you can use any of those 3 and use those sources to highlight what you're learning. If you read the textbook, if you're doing questions, then watch those videos to give you another pass through the information is kind of the solidifying thing for you. Or, hey, you don't quite understand that. Maybe hearing somebody else talk about the information is going to make it clear for you. So, pick up one of those 3 and you will be doing all right with medical school pharmacology. All right, on to my next resources, the question banks. So I've already talked about the question banks a little bit earlier in the video, so I'm just going to do a quick rehash. Question banks that I really liked were the PRETEST series, Pharmacology. Why I like that textbook is the questions tend to be, so medical school questions have what I like to call a quick factor, or how quickly you can read through them. Some questions, like Guyton's Physiology question bank, are kind of written to really make you think and chew on the material, and they kind of pull. It's not just a short question, can you put a couple things and learn it? It's, I'm going to throw all this information, a USMLE style question, and see if you know the answer. Whereas the pretest questions are, yes, they're USMLE style questions, but they're going to have a little bit less information per question. So instead of saying, I'm going to give you this, 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 and this, and see if you can put everything together to get the question, the pretest questions are going to be, I'm going to give you this, this, and this, and see if you know the answer to that. So when you're trying to learn the information or you're trying to get quick associations and build those associations, it's a lot easier to get through 60 questions of pretest, which are going to more test your basic knowledge, rather than making it through other question banks, which might be testing more your ability to synthesize a lot of information. So the pretest is going to test more your knowledge, and it's going to more build your knowledge, where some other question banks are more going to be testing your ability to use that knowledge. As in, it's going to say more your synthesizing ability rather than helping you learn more. So I would recommend picking up pretest. It's really going to help you as you're going throughout medical school. Another question bank that I tried was the Lippincotts Illustrated Q&A Pharmacology. That question bank was all right, but I found it had a lot of errors, and I found some of the questions I don't think they were quite as well put together as pretest. But again, maybe you'll like that question bank. So if that's something for you, pick it up and try it. But as far as question banks go, you know, I go back and forth. Some days I really like this question bank. Some days I'm going to pull some questions from this. Another thing you can do, Kaplan puts out a 1,000 question Q bank. So if you kind of just want some general overview of questions, you can use their pharmacology questions. You can use UWorld question banks over pharmacology. Or you can use Firecracker and go through their pharmacology questions to kind of learn concepts. Firecracker is really good to help you review and learn those concepts and really drill them into your head. USMLE DEJAREVIEW series also has pharmacology it sets it up and gives you, this is kind of like flashcards, but in like a page concept. You look at it, it says, what is this? This. What is this mechanism of action? This. So another resource that you can use to help drill those in. And don't worry about memorizing or writing down all these resources. I'm going to post a PDF link to all the book recommendations I have. So as far as question banks go, I would highly recommend doing some of those pretest questions. If you are going through your cardiology block, a couple days before your exam, go to those question banks. But again, try a lot of them and see what works for you. These are my recommendations. I think they'll be really good as a starting point for you guys, but maybe you're going to find something else that really works for you. Okay? So let's go ahead and wrap this thing up, shall we? All right, guys, you are listening to Renegade Medicine. I have just given you guys resources and a little bit of tips on how to succeed and study pharmacology in medical school. I hope that this video has been really helpful for you. I am Jay Allen. If you enjoyed this video, feel free to like and subscribe and recommend this to your friends. And as always, I don't know what I was gonna say there, but Nietzsche wants to say adios. Nietzsche, say adios. Nietzsche. Okay, take care, my friends. Until the next video.